Hi, Dr. Man again, mini health talk to get you healthy again. Today, we're going to talk about benign prostate hyperplasia, Chinese medical treatment, and daily health prostate practices. So, what causes the benign prostate hyperplasia? Number one, sex hormone change. As we're getting older, or male hormone declining, the female hormone increasing. So that kind of hormone change will make the prostate enlarge. Number two, aging, that's the same thing. Family history of BPH. Any family member have BPH, you have more chance to get the BPH too. Diabetes and heart disease patients, obesities, frequent urinary tract infections to stimulate the area to make the overgrowth. Inflammation of the prostate, prostatitis, the chronic ones. And narrowing of the urethra, that can also cause prostate enlargement too. Black and white men are more than Asian men. So if you're black and white man, you have more chance to get the BPH than the Asian men's. Next one. So what is the pathology of the BPH? Pathology of the BPH is simple. It's the stromal and epithelial elements of the prostate arising in the periurethral and the transition zone of the gland. You can see from this illustrator here. The hyperplasia presumably results in enlargement of the prostate that may restrict the flow of urine from the bladder. This is the main pathology. To understand that pathology is that they said may restrict the flow of urine and it may not too. So our job when we have a BPH patient is not to shrink them, but to stop them to getting bigger and make sure to increase the urine flow so that they don't block the flow of urine from the bladder. Next one. So diagnosis is very simple. You use a digital reticle exam. You use a finger to touch the prostate area. You find a smooth enlarged prostate. If they have any nodules, that's not a benign prostate. It may not be a benign prostate hyperplasia, and you need to do a pathology. Urinary flow test, post-void residual volume test. You want to see whether the patient can empty their bladder after their urination. 24 hours voiding diary, transrectal ultrasound. Those will show you more information of the prostate. Prostate biopsy, this is usually to differentiate the BPH from the prostate cancer. Urodynamic pressure flow studies, this is usually for the urologist, and cytoscopic, so you can use endoscopy to look at the prostate. Next one. So acupuncture treatment. When we talk about acupuncture treatment, please don't jump into the points right away. As a healer, you have to remember we're the healer, we're not just a therapist. We need to focus on the causes and the pathology of the BPH. That's applied to any disease when you are as a healer. Since the cause of BPH are mainly the increase of stromal and epithelial cells, by the stimulation of the inflammation and chemical components in the urine, we can reduce the stimulation factors by number one, which is have a clean sex with baths, or sometimes if you use oral sex, you should use Listerine to clean your mouth, okay, and the genital area. Number two, do the ankle exercise as shown on my YouTube mini health talk channel to drain the toxins from the lower extremities. We are standing mammals, so each time we're standing, all the toxins accumulate in our lower body, which in return will come back to our body to harm our body. When they passing through the urine, they stimulate the prostate too. If you do the ankle raising exercise to help you eliminate the toxins, you will have less chance for your prostate to be getting even larger. Number 3, alkaline your daily food intake to reduce acidity stimulation to the bladder and the prostate. You can alkaline your water or food. Our family have nobody have prostate enlargement, and also in Asian they have less prostate enlargement because they use baking soda a lot. So as that kind of enlightenment, I want you to, if you have a BPH, I want you to alkaline your food and water intake a little bit and see how much it's going to help you. Number 4, abdominal and pelvic muscle exercises like this man do to increase strength of bladder muscles to void the bladder. So when you have a stronger abdominal muscles and pelvic muscles, they can squeeze the bladder hard enough to void it. Each time the bladder is voided, the prostate, they won't harm your bodies so much. 5, avoid coffee and alcoholic beverage. Those kind of beverage, they were stimulate the prostate, make it more inflamed, more cause more restrictions to the urine pathways. Next page, please. So acupuncture point selection are mainly to strengthen the bladder muscle and desensitize the prostate smooth muscles. So you want to strengthen the bladder so that it can void it, and you want to desensitize the smooth muscles in the blood neck so that they don't constrict too much to prevent your bladder from voiding. Locum points, I use Ren 3, Ren 4, and Ren 6, and also 子宫 electric stimulation. 子宫 in men is just like a testicles, so you stimulate that helps too. Distal points, I use 395, that's drain the dampness. 妇科环槽 to women is treating the gynecology, to men will treat the reproductive system too, and the penis, that's a Richard Tan's points on the index finger, you can stimulate that. And 3 yellows, that's a master tones points, and kidney 6 and spleen 6. You can also choose ear points, prostate and bladder to stimulate and see whether you can shrink it. Okay, next page please. As for the Chinese herbal therapy principle, are to decrease the size of the prostate. We have the herbal medicine are supposed to decrease the size of the prostate. I don't know how much they can decrease the size of prostate. At least they can slow down the progress. Cleansing the urine pathway and desensitize the bladder neck areas. So I use 桂枝茯苓丸. This is mainly Chinese medicine to deal with any nodules, especially you can work with the prostate too. And 八正散, which is drain the toxins from the urinary system. 银桥散 is just like a cleansing the upper respiratories and cleansing the urine, make the kidney clean the kidneys to make the kidney create quality urine so that they don't stimulate the prostate so much. 白芷 and 盐胡梭, which is just desensitize bladder neck so that you don't feel that urgent and frequent urination. Usually you take 3 grams 3 times a day, dissolve with the herbal blender with hot water and shake well before use. Let me explain how we use it. The 桂枝茯苓丸 to decrease the size of bladder, 八正散 and 银桥散 cleans the urine pathway. 白芷 and 盐胡梭 desensitize urine pathway. The more the symptom of the urgent and frequent urination, you may increase the 白芷 and 盐胡梭, and decrease or take off the 桂枝茯苓丸. If the inflammation is predominant, you may increase the 八正散 and 银桥散. When there are no symptoms, you may increase the 桂枝茯苓丸 and take off the 白芷 and 盐胡梭. So the dosage here is all, you can always play with it so that you can make the best formula which is fit for patients' need at the moment. Next page. As far as you follow the treatment plan, 80% of the patient should be become asymptomatic in 3 to 6 months. The other 20% of recovery usually takes about anywhere from 6 months to 12 months, depending on how well the patient do the prostate series of exercises. So I want to thank you again. If you like our program, please subscribe to our channel and give us a thumb up. We'll see you next time. Thank you very much.